British Columbia Nurse Practitioners Association states a nurse practitioner is a registered nurse with a master's degree, advanced knowledge and skills who provides high-quality health care. NPs are able to diagnose, consult, order and interpret tests, prescribe and treat health conditions. They work independently and collaboratively to provide British Columbians with primary and specialized health care using a team-based approach.
As a family nurse practitioner, my primary role with a patient is obviously to provide primary care to them. So they come to me for their sort of entrance needs into the healthcare system. So my role initially is to really develop a sense of safety and working with them in where they're at in their life and what they need to see.
When you add what a physician and what a nurse practitioner are able to bring out of a particular patient in a particular clinical scenario, it is actually very complementary and additive in a sense. And together, the two are quite a synergistic pair.
What I love most about being a nurse practitioner is that based on my experience and my education, it allows me to practice at an advanced level. As a nurse practitioner working in cardiac surgery, I'm often the first face they see as I follow them through the continuum. After their surgery, I see them in ICU and start preparing them for discharge and seeing them on a daily basis as well. You know that you're not only protecting your patients from all the surgical risks, but you're also managing all their social and chronic disease issues as well.
I think that working with an NP has made my job more rewarding. I think that I have a better handle on their health issues, especially the complex and chronic patients and elderly patients. I feel like I'm managing them better. We look at our patients as a population, and we try to develop strategies around providing better care for them, improving their access and dealing with their issues, particularly their chronic issues. And so we manage the population, we don't just manage the individual patients.
I work with frail elderly clients as well as those over 19 with chronic disease such as MS, Huntington's, as well as those with acquired brain injuries. It's always trying to solve a puzzle because these residents, again, are complex, multiple chronic diseases with an overlay of dementia, so trying to figure out what's going on. I think the biggest thing is I love the challenge. I think the other part of it is feeling that I have more of an ability to create change in this role, more power to create change and be a voice in this role.
What I love most about being a family nurse practitioner, for me, it's the continuity of care and experiencing life with my patients and seeing their journey and their successes and moving with them throughout their life journey. So and I just like having that connectedness with them and working with them. I find that when you develop those relationships, you can really work on things that take a long time and are difficult, but you can see really small improvements after short periods of times. And when you think long term, you can really see the successes of some of these difficult situations.